Okay, we're back again, and we're going to do our question and answer session about radiation safety. And so I'm going to turn this around, if I can figure out how to do so. And Casey.
Hi, my name is Casey Adams. My student number is 3123126, and here is my ID. Okay, I'm ready for the question.
Okay, number one. So, what is the radiation monitoring device called?
The dosimeter badge.
Okay. And so, if we're using that dosimetry, how does it work to measure how much exposure we're getting to radiation?
The badge, if placed properly, measures the amount of scatter radiation that is in the room that the body absorbs.
Okay. And how do we obtain the readings?
The dosimeter reader that we have gets sent back to the lab that it comes from every quarter, and it gets measured properly that way.
Okay. When should you wear a badge? Should you just wear it when you're under the beam, or when do you wear your badge?
You wear the badge anytime you are exposed or near any radiation exposure.
Okay, so even if you're standing near the room, in the room, if you are taking
dental x-rays, yes, you put it and wear it on the whole time.
Okay. And do you wear your badge outside when you go pick up a patient?
No, because the sunlight does affect the radiation exposure to it.
It will increase your reading, correct. So, did we say where you should wear it?
We should wear it on our thyroid shield as close as you can to the thyroid shield, or at the top of the gown.
Okay. And it measures MPD for your veterinary staff. So what is the MPD maximum for your veterinary staff every year for whole body?
It is less than 5,000 MERM a year.
Mm-hmm. Good job. All right, so do you have a dosimetry report? Can you show what that looks like?
Yes.
And
I do have a dosimetry report. We're going to use myself on here. So we are going to go down to my name, which is Adams. We're going to go over to the number right here. So this is the amount that this quarter that I have absorbed, or my badge has absorbed from the radiation that I've been exposed to. And then over here in this back column is how much that I have absorbed that quarter, and as well as how much I have absorbed so far this year.
Okay. And then everyone's totals are
right here in the deep.
Okay. And we keep all of those on file so that we can look throughout the year.
Yes.
Okay. Okay, so the next section is general radiation safety. So can you list and explain the 3 methods of restraint used in radiology?
Yes, so it is physical, non-manual, and chemical.
Okay. And chemical would be like?
Any sedative medication to help the patient relax for the x-ray.
All right, and physical is when you're standing there
near the patient and having to hold the patient in position.
And what's the other one?
The non-manual would be using our restraint methods for like our surgical rope, holding the patient with that, but not as close to the beam.
Okay. All right, so you brought that rope or whatever in, so let's discuss and show us 3 positioning aids that are used in radiology.
Okay, so like our surgical rope here would be used to attach to the foot and to hold the foot, so that way we're at least further away from the beam and we're not as exposed. Our foam wedge would be used. It is just a piece of foam wrapped up in a sheet, so it's a little more comfortable for the patient. So that way we can position either a leg or have supportive towards the head for that.
Rolling, that kind of thing.
Rolling.
Yep.
And then we have our V trough that we use a lot of times when we do our VD x-rays, just so that way the patient's more comfortable on their back, and it keeps them in a better position.
Okay. And let's see, discuss physical protective barriers that can be utilized in the radiology suite other than your PPE.
So other than the PPE, if your hospital has a lead door that you can stand behind or a lead wall that you can stand behind to especially do the exposure button, that is better or is just as well as your PPE.
Okay. And how does distance or exposure time settings on the machine, how can you utilize those as a safety measure?
So the less of the exposure time that you can do is better, so that way your body is not continuously absorbing more radiation that you're putting the patient or yourself through, and the barriers help by keeping...
Or distance, I'm sorry.
Sorry about that. The distance allows your body to stay further away, so your body's not absorbing as much as if you were right close to the beam.
Okay. Because as it scatters, it spreads out.
Yes, as it scatters, it continues to spread in a further pattern.
Okay. So, explain why no portion of any human, with a shield or not, should be exposed in the primary beam.
So, even if, like, you have your hand in a shielded glove, your hand is in the beam or closest to the beam, your body is still absorbing some portion of a higher amount than if you were backed up from the beam.
All right. Nothing is 100% protection.
Yes.
Okay. So why do we only want our non-essential people to be removed from the x-ray suite and only have our essential people in there?
Because the less people that are in there, they're not everybody needs to be in there to expose radiation. If you can do one or at most 1 to 2 people in there, that way less people have the exposure to radiation.
Okay. And why should we make every effort to obtain our images on the first exposure?
So that way the patient and yourself have less exposure time and absorb more scattered radiation.
Absorb less.
I'm sorry, absorb less scattered radiation the less time that you're in there.
I know what you meant. Okay, so what's a good scientific reasoning that we restrict our pregnant women and people under the age of 18 from the x-ray suite if we possibly can?
So their bodies are still growing and they have dividing tissues that do not need to be exposed to the radiation because they're more susceptible to absorbing that and damaging either those growing or dividing tissues.
Good job. Good answers.
Hi, my name is Casey. I'm going to go over our radiation PPE equipment and also go over our positioning aid equipment that we have here. So we're first going to check our PPE radiation equipment just to make sure that there's no cracks or holes, to make sure that we are fully protected before doing radiation in the same room with the patient. So we have our gloves that we're going to go over and just make sure that there's no holes and everything on both gloves, and there is no holes. We only have one pair of lead glasses that I will wear, and then we have our radiation dosimeter that has my name on it with my information on it. And we have our lead apron just to make sure that our body is fully protected. And we also have our thyroid shield just to make sure that also our thyroid is protected, to make sure that we have no issues with that. And everything looks good. There's no holes or cracks in the equipment. Here are a couple of our positioning aids. And here is our surgical rope that we use to help keep the legs straight so that way we're not in direct contact with the beam. And then we have some foam positioning agents just to help keep the leg and from rotating, as well as we have some foam holders as well, just to make sure that they're in a straight position, and as well as a plastic one as well. So that just helps with that. And then our measure that helps tell us which MAS and KVP that we use for the proper equipment, proper view, and also our right and left markers to say if we're on our right side or our left side. All right, we're gonna put our PPE equipment on now. We're gonna start with the thyroid shield. And now the gown. Make sure there's no wrinkles. We're gonna put our dosimeter on our thyroid shield so it monitors properly. And then we're gonna put our glove. We're gonna put our lead glasses on first. They're a little big, so pardon the look. And then we're gonna put our gloves on. And there we go. Hi, so we are going to pull up one of our patients so we can put in a radiograph view. So we use Cornerstone here to make it a little easy. So we have a client ID. If you don't know it, we click and pull up the client by their last name. Then at that point, once that is up, we go down to our animal that we need to take a radiograph of. We go to their patient visit list, and then we put in the radiograph that we need. We are going to take a single view of our feline smudge, of his radial ulna cranial palmar view, and it's going to be a single view. And it pops up with a description and what staff member is doing it. So we're going to put it underneath our preceptor, Dr. Sanderson, and then we just put in the view that we need. And then select OK. And then at that point it goes over to our machine in radiology.
And we walk to radiology.
All right, and here is our computer in radiology. And if you see right here, this is a touchscreen, so I have to be a little careful, that we have smudge here, and it pops up with who requested it, what is the request, and what view we need. We are going to do the right front radial ulna view, and I'm going to do the dorsal palmar, and then once we have the patient ready, we will measure and then select on the size that we want. Once we have the selected size that we want, and the computer does calculate, but it does not go over to our machine, we have to first turn on the machine. We find out which view we need, and then we change our MAS and our KVP. Right now our MAS is correct, and we just need to change our KVP to 68. We are at 63, and there we go. So then when we're ready, we can just highlight the view and take the picture. Okay, now that we have smudge in the computer, We have him all, we're gonna double check our measurement to make sure. So we're gonna come over here to Smudge. He is under some light sedation right now, so he has a monitor on him to make sure his EKG and his SpO2 are doing well. And we are doing his radial ulnar view. So we're gonna take the caliper and we are going to measure. As you can tell, he's still lightly sedated.
You have to zoom in on the numbers that it measures, which is at the bottom.
Show where our measurement is.
Can you see them?
Okay, so that we can see he is right at a between a 2 and a 3. So we're gonna go ahead and take this off. Like I said, he is lightly sedated with a monitor on. So then we're gonna come back over here and change our setting to 1 to 5. So it is 63 kVp and 7.5 mass. Because our machine is not ready, we're gonna change our settings. So we're gonna go and fix that now. Alright, now that our machine is set, we are going to turn off the lights so we can properly collimate and get him positioned. We're going to use our rope to attach to the leg. So we're going to do one at the elbow and then one at the foot to make sure we get that full extension. We're going to use our foam pad to keep his face out of the view. And then we are going to collimate to get the middle of the paw in the triangle. So we're going to go down. And we are going to collimate just like this. And our cross is now what it needs to be.
Elbow in it. You're doing it purpose. You need to have your elbow. There you go. Good job. I know, buddy. You're okay. There we go.
So we're going to put the marker at the toe.
Make it a little bit narrower on your collimation. There we go. And the rest of us are going to get out of the.
We're going to put our glasses on.
You're going to look down and see the pedal where she's going to activate the film from with her foot.
Alright, and everybody's out of the way.
Mm-hmm.
And we are taking the image. So once the beat goes off, we're then going to come and double check our view on the screen. And we have our radial. We're going to check our measurement. And
Take him out of the V.
we're going to have to take it out of the V just to make sure.
Slide him into this V. And slide your other one out.
We're going to leave just a little space there so we can measure properly. So we're going to go behind and above. So we're going to get the highest point of his ribs and his backbone. And we are at 22. So our measurement on our computer is right. We just now need to change it on the machine. So we're going to change it to 7.5 mass and of 80 kVp. Alright. Before we put our gloves on, we're just going to try to get him centered and properly put in his view.
Do you move this?
Yeah, let's move that down. Alright. So we're going to have this moved in. Our marker is right here. We're going to put it right down here at the end of the V that's holding his head and neck. We're going to turn his head so it is perfectly straight with the middle of the line. I'm going to get my gloves on real quick before I do. The X goes at the highest point of the ribs, so once we get him pulled and adjusted a little bit more, he will be there.
And I will leave the room.
We're going to get our gloves on while he is so lightly sedated. We're going to
As
take,
few people in the room as possible. So we're going to go behind this little door.
so we have a straight neck, arms pulled out of the way. We're at the top of his rib cage, and now we are going to take our view. Now before we get him out of our colony, our V's, we're going to just double check our x-ray. And we can as well see that the barium has moved further down. Alright, we are getting George now also ready to do his OFA hip x-rays. We've already done his barium study. We're waiting for a couple minutes for the barium to move down his intestinal tract. So while we're doing that, we're going to get him prepped for doing the OFA hip x-rays. So we've already put it in the computer for the x-rays to be processed. So we just need to measure and go from there. So we are going to go under and to the spine. And it seems that he is at 18. So our measure is off a little, but it does say 18 there. So we are gonna now put the collimator away. We are gonna set it to 18, which it is at the 15 to 20 setting. So it's at the pelvis. So it's supposed to be for 85 kVp and 10 mass. And we are at 83, so we're gonna just change that really quick. Alright, and he is lightly sedated now, so we can get these proper x-rays. So we are gonna use our V to put him in to get a good full extension. So once we get him in the V, then we'll get in our gloves on to keep our hands out of the view.
He doesn't like to stay seated. There's my buddy. I got you, baby. I got you.
He is under very light sedation right now, as you can tell.
He is an MDR1
Patient.
patient, so
We have to be super careful.
underdose sedation. On him.
Okay.
I need to get some gloves on.
Alright, so we're now going to try to get our gloves on while he is in position. So our hands are protected.
That's a nice good boy. That's a very good boy.
Alright, so we have his pelvis in the view. We have the marker marked. Can you back him up that way just a little bit? So we're going to try to get that full extension, so we need to back his body up just a little bit so that we can get that full extension and rotate them hips in so that way we can get that proper view.
Just a little further.
So we are now about right in the cross. So now we're going to take and rotate his hips in and pull down, and now we are ready to take the view. Now we're going to just double check our view and make sure what we have. Alright, so we're going to do a barium study, and we're going to use our barium sulfate suspension on George Sanderson, and that is Dr. Sanderson's dog. Typically you would use between 5 to 13 mLs per kilogram, and we are going to actually use 10 mLs per kilogram to calculate his dosage. So we are going to take George, that is spelled with 3 O's, and he is 45.8 pounds, and we are going to divide that by 2.2 kilograms, which comes up to about 20.8 in kilograms. And then since we are doing it by 10 mLs per kilogram, we're going to times it by 10 mLs per kilogram, which comes up to about 208 mLs. Because he does not need a barium study today, we are only going to use about a fourth of this dosage. So he's actually going to get 45 mLs of the barium sulfate solution today, just so that way he doesn't need all of it. We're now in radiology. We're going to pull up George. We're going to do his radiograph, right lateral, and now we are going to measure him. That's Mama's boy. So you want to, for the lateral abdomen, you want to get at the last rib, and he's chubby. Measure, and it looks like we are at 15. So because he is a little thicker, we are going to go on the next size up. So we're going to go 15 to 20. So then we're going to come back over to the computer. We're going to set the computer. So he is at 83 kVp and 10 mass. So
George,
before we do our put our gloves back on, since he is being a little uncooperative.
It's always the doctor's child. You're gonna get your sedation soon, Doodle, but not with your barium.
Alright,
Not
so
with barium.
we are still in our views. We are going to use our gloves. And then we are going to take the view.
Alright, we're gloved.
We are all gloved up.
Hi, I'm Dr. Jennifer Sanderson. I am a preceptor for Casey Adams, and we have just completed her radiation or radiology project. And her semester of learning some radiology has been fun because although Casey's been able to hold for animals and has seen, you know, what we do here as a clinic, it's been nice for her to understand a little bit more of why we make changes in our KVP or our MAS and what do those things, what changes on the radiograph, because we don't have to make those changes like we used to with our film. You don't see the big difference as much, and so I think it was interesting to see, you know, those kinds of things make sense to her. She's learning to line up the beam a little more appropriately. We all get lazy with that over the years. I'm just as bad as everyone else because we want to get the most in every shot, and that's not ideal for the best shot. So she's learning to line that up and collimate appropriately. She's always been very good about making sure that we have our markers placed in the field appropriately. She's always been very good about patient handling and being really careful with them and being aware of their anxiety so that we can make sure that we handle things. My dog is the exception, so unfortunately you don't get to see the greatest example because even with sedation, he's a little high on the anxiety list. So forgive us. We really do more fear-free techniques, but when it's mine, it's my own child. I'm not as patient with him. Casey has learned quite a bit, though, I think, and her techniques are improving little by little every time we're in there, and she's finding her voice and being able to direct a little bit better to our other assistants and telling people kind of what we need and we'll make the best shots. So I've been happy with it so far. You know, we still have a way to go. There are different things to learn that I think time will only tell, and look forward to those times and teaching her along the way. Thanks.